Good morning, everyone. Good morning to our media partners and those who are joining us live on our social media platforms. Today, we have Yusek Rosette and Yusek Mirna Kabotahe in our July 9, 2021 Media Forum. With that, I give you the spokesperson of the DOH, Undersecretary Maria Rosario Sinvergere. Yusek.
Yes, magandang umaga po sa inyong lahat. Happy Friday. Gusto lang ho naming i-welcome kayo lahat ulit dito sa ating DOH Beat COVID-19 Media Forum for this Friday, July 9. Sa patuloy po nating pagbabakuna laban COVID-19, binibigyang diin ng Kagawaran ng Kalusugan ang kahalagahan na mabakunahan ang mga individual na may pinakamataas na panganib sa COVID-19. Inilunsad kamakailan ng DOH at ng National Vaccine Operations Center ang Tutok A2 Initiative na naglalayong hikayatin ang mga local governments, regional at local vaccine operations center at iba pa nating vaccination units na siguraduhing i-prioritize ang mga kababayan nating senior citizens sa pagpapatupad ng ating vaccination program sa ating bansa. Pinagtutuunan ng pansin ng inisyatibong ito ang challenges sa rollout ng bakuna sa ating mga nakakatanda or senior citizens at ang paghahanap at pagbibigay ng angkop na tugon sa mga ito. Itong linggo nga po ay nagkaroon tayo ng Tutok A2 Town Hall para patuloy pong maipalaganap ang vaccine confidence sa ating mga senior citizens. Ito po ay isa lamang sa mga hakbang na ating ginagawa upang maabot natin ang ating pagbabakuna ang mga taong higit na nangangailangan nitong mga bakunang meron tayo ngayon sa ating bansa. So ngayong umaga po, kasama po natin si Undersecretary Mirna C. Kabotahe. Siya po yung head ng ating vaccine cluster dito sa DOH para bigyan po tayo ng updates patungkol sa ating COVID-19 vaccination and deployment program. Yusek Mirna, you have the floor.
Salamat, Yusek Rosette. Magandang umaga po sa ating lahat. Ito po yung ating ulat in terms of the vaccine deployment. If I can have my slide, please. So next slide, please. So as of yesterday, alas 6 ng hapon, we have already jabbed 12,700,000 doses. 13.4% or 9.4 million are the first doses. This is 13.4% of the 70 million. And 4.5% of the 70 million are second dose. So 3.2 million of the 9.4 million have already received their second doses. And kahit may konting limitasyon sa ating mga bakuna, the health facilities were still able to do their daily jobs. So we range from 200, we average now 200 per day daily jobs. No? Next slide, please. So this is the more granular data on our doses administered with a weekly accomplishment of 1.6 million. We averaged 200. There was one time we had almost 500. No, so going to the different priority age groups, we have vaccinated for first dose 1.6 million of our group A1. Gusto ko pa lang pong explain na huminto tayo sa A1.1 hanggang A1.7 anong May. Para lang yun yung tinatawag nating last mile master listing. Pero with new developments na pinayagan yung ating OFWs, tapos yung mga family members, household members ng ating healthcare workers, tapos yung mga bagong hire, yung mga bagong interns, bagong clerks, meron tayong expanded priority A1. Kaya meron pong another column that is saying that we have already vaccinated 161,000 of our outbound OFWs and some members of family of our healthcare workers. At tapos yung additional A1, yung ating mga new hires sa mga ospital, yung ating mga interns and clerks who are rotating. No? And then ang senior citizen natin, 2.6 million out of the 8.2 million have been vaccinated. And for our priority group 83.1 out of our 7 million targets, and you have the second doses data who have already completed. Sa ating mga A4, yung ating frontline personnel and essential service, nakatala na po tayo ng 1.6 million. Ito pong A4 is initially limited to our NCR plus 8. And we have vaccinated 1.6 million out of the 35.5 million that have been estimated by NEDA. Hindi ho pare-pareho ito sa mga different areas, no? And we also started to do our A5. This is the poor population at 295,000. Next slide, please. So in terms of ramping up the vaccination, we have our objective to up the COVID-19 implementation program on 3 apps. No? We want to update you. We have now our focus and expand strategy, dati na yan, but we are now focusing in accomplishing our priority groups, A1, A2, A3. Ilang beses na natin sinabi, these are the most at risk, most vulnerable. We have some deadlines for our regions, supplies permitting. So hopefully all A1 will be finished by end of June. This is the A1.1 to A1.7. Hindi pa kasama ito yung expanded. And tutok A2, we are targeting 90% by end of July, and by end of August sana ma-reach na natin yung 90% of our A3. In terms of our focus areas, alam na natin yung NCR plus 8, yung NCR tapos yung Calabar and Bulacan, Pampanga, Metro Cebu, and Metro Davao. And the new IATF resolution also extends, so NCR plus 8, we have now plus 10 areas that include Baguio, Tuguegarao, Naga, Legazpi, Bacolod, Iloilo, Dumaguete, Zamboanga City, CDO, and Jensan. These are the areas with current rise and previous rises in cases. And we are also expanding to model cities, no? At least 2 cities per region para mas matutukan po yung kanilang jabbing at tapos yung kanyang inventory. Part of our updates, we will be helped by USEC Rosette. Ano na ba yung ating mga possible vaccination of below 18 years old? Yan po ang mga tinatanong. May mga pulisiya po tayo dito. We'll give you our vaccine horizon. Ano ba yung mga available na vaccines? And you're always updated when there are deliveries. And yung boosters and the mixing of vaccines that have been given to the technical team, the experts group headed by USEC Rosette to give us policies later. No? And next slide will tell us the next up. We want to upgrade. We are now moving for reporting daily coverage and vaccine inventory. Basta po yung mga nabakunahan sa bakuna center, sinabit sa LGU, dapat po may line list para naka-encode sa ating DICT, VINS, and PAS, yung ating vaccine administration system. We are now trying also to put the inventory para makita natin kung ganito ang na-receive nilang vaccine at the beginning of the day, ilan na ba yung job, ilan na ba yung naiwan nila. So we are in these processes so that we can do better planning and allocation. And then also our cold chain and logistics, ano ba yung stocks, ano ba yung mga problema ng mga different areas in terms of the cold chain. And then we want to upscale, no? Ang ating pong layunin, we want to vaccinate as many and as fast, but at the same time looking at reserving the second dose. This is the new app, no, that we would like to encourage not only to A2, A1, and A3, but also for second doses to finish their second doses. Yan lang po, USEC Rosette, and all those who are watching. Maraming salamat.
Maraming salamat po, USEC Mirna, para po sa inyong report today. So I'll begin with the questions na vaccine-related po na sinubmit yesterday. So from Caroline Bangkin po, meron na po bang national database ng nabakunahan at magkakaroon po ba ng Uniform Vaccination Certificate or Pass for All? Iba-iba po kasi ang itsura at details ng vaccination cards ng mga LGUs. Yun pong iba, handwritten yung form. So USEC, paano po ba to?
In terms of the percentage by region, we have even in our vaccine statistics, no? Ano na ba yung coverage by region? It will be available to you through the communications media unit of the Department of Health. This is being updated dati weekly, but we will be able to do it. We will do it by regional allocation will be available. No. Next, in terms of the vaccine certificate, in our national deployment and vaccination plan, may prescribed format yan. But alam naman natin na everybody wanted to be on the forefront, so they have devised their own system. Pag naayos-ayos na itong ating sistema ng DICT, it's on its process, then we will have one vaccination certificate format that will be issued by the DICT. Thank you.
Thank you, Yusek. Two-pronged question for Yusek Vergere and Yusek Mirna. May update na po ba? So for Yusek Reset from JC Cosico, may update na po ba sa interval ng first and second dose of our current jabs, or it remains the same? Para saan po ang disparity between the first and second doses? And then for the next question kay Yusek Mirna is, how do we ensure na may vaccines na matitira for the second dose? Yusek Vergere.
Yes, JC, yung binigay na indication for second doses, these were all based on the clinical trials that these specific vaccines went through. So dun sa mga clinical trials nila, tinignan nila ano yung best time to give the second dose para makita talaga yung mataas na efficacy for that specific vaccine. So pag tinignan natin, iba-iba talaga. Makita mo AstraZeneca, nagbigay ng indikasyon 4 to 12 weeks. And sabi din nila, the longer the time that you have for interval for AstraZeneca, mas mataas yung nagiging efficacy because that's the result of the clinical trials done para ma-improve nila yung efficacy ng kanilang bakuna. For Sinovac, for example, ito rin yung kanyang specific number of days kung saan nakita nila. For Sinovac, nung ginagawa ang clinical trial, they did it, no? Naglagay sila ng 14 days, may 21 days, may 28 days. Tinignan nila among this interval of doses, ano ba yung may pinakamataas, no? So nung ginagawa nila yung trial na yan, at nakita nila pinakamataas ang efficacy if you have 28 days for Sinovac. So yun yung rationale kung bakit magkakaiba yung second doses na schedule ng bawat bakuna based on sa pag-aaral ng bawat manufacturers based on their clinical trials. Now, ang atin ngayong punto at saka ang ating ginagawang strategy, we follow the indication that was given by the Food and Drug Administration. So halimbawa, sinabi ng EUA, o yung Pfizer 21 days, yan ang sinabi doon sa kanyang sinubmit na mga dokumento at dyan talaga sinabi na dapat ibigay because the efficacy will be higher in this interval for the second dose. So yan ang pina-follow natin. Pero syempre alam natin there would be circumstances na talagang magkakaroon ng factor kung bakit hindi nakakuha ng second dose ang isang tao. Maaring nagkasakit siya, maaring na-quarantine siya, maaring hindi siya nakapunta because there were other personal circumstances sa kanya. Ang sinasabi ng ating mga eksperto, hindi mo kailangang ulitin ang series ng pagbabakuna. You have 3 to 6 months to complete your second dose. Pero ang atin pa rin paalala sa ating mga kababayan, get your second dose as soon as you can based on the indicated interval na sinabi sa inyo na schedule nyo. Kung sakaling may valid reason, bumalik lang agad doon sa inyong vaccination site to get your second dose. Hindi kailangang umulit. Laura?
Salamat po, Yusek. So, klaro po yon yung intervals, prescribed intervals based yan sa clinical trials. Pero 3 to 6 months, pwede pa rin po kayong kumuha ng inyong second dose. Yusek, Mirna, ang tanong po is, paano po natin nasisigurado na meron po tayong sapat na bakuna for our second dose and may enough supplies nga po ba tayo?
Based on the different intervals, we ensure that meron tayong enough second dose. Ang dating polisiya, we reserve a second dose. So we do that for Gamaleya, Sputnik V, kasi iba po yung component 1 sa component 2. So hindi talagang naka-reserve yung component 2. Sa Pfizer, naka-reserve din and for Moderna. Dito po sa AstraZeneca, at one point, nung dumami yung mga cases and then we had a good number of vaccine, we decided to use all as first doses, pero dumating naman in time yung mga second dose. Now, yung Sinovac lang, because initially we were assured na may weekly delivery, so for the NCR +8 areas and some surge areas, we allowed them to use second dose as first dose. But nung medyo pumapalya na, hindi naging regular, we have advised them to already ensure a second dose. This is only for Sinovac. Before, ang polisiya natin, ang binigay natin na Sinovac, first dose and second dose. Kaya lang, masyado tayong malaki ang inventaryo kasi maghintay ka ng 28 days. So what we did was try to look at the possibility of jabbing the second dose as first dose. With assurance na for the next 2 weeks na magsa-second dose ka, meron. But hindi naging regular yung supply. So now we are going back to really studying na may naka-reserve pang second dose at least for 2 weeks para at least every 2 weeks meron tayong ano yung tawag dyan, delivery or shipment ng Sinovac. But the other vaccines, we have 100%, 1:1 na reserves.
Thank you po, Yusek. Next question po is from Carlin Bongkino. Ano po ang region na may pinakamataas na vaccination rate? Ano po ang region na may mababa? At may effect po ba ang vaccination rate sa number? Nakikita na po ba natin yung effect nito sa number of deaths and hospitalization based on the data? So, yun, Yusek.
In terms of the pinakamataas na vaccination coverage, of course, yung binibigyan natin ng pinakamaraming bakuna, sila ang mataas ang coverage, no? So, nag-focus tayo sa NCR. Most of their A1, A2, and part of their A3, pinakamatataas yan na coverage. Sumusunod na po yung ating +8. So, kasama sa +8 natin ang Region 3, kasi Region 4A, 4 sa kanyang probinsya nakasama sa +8. Tapos yung Region 3, 2 sa kanyang probinsya nakasama sa +8. Sumusunod po ang Davao and Cebu kasi sila din ang Metro Cebu at saka Metro Davao. So sila po ang maraming mataas ang coverage kasi sila din ang nabibigyan ng maraming bakuna. In terms of pinakamababa, of course, BARM, because the population is small, we have challenges in delivering vaccines to the BARM, but we want to assure everybody that we are also giving vaccines to the BARM. Yun lang pag-deliver na sa Basilan, Sulu, and Tawi-Tawi is facing challenges. So they have the least vaccine and they have the least coverage. Thank you.
Yusek, maaari niyo lang ba kaming i-refresh kung paano ba natin, ano yung framework natin in terms of allocating vaccines?
Una, kagaya ng sinabi natin kanina sa focus and expand, unang-una yung prioritization framework, no? Sectoral. So ang sectoral prioritization by healthcare workers, kasi sila ang most at risk at most vulnerable, we have accomplished almost 100%. Ang medyo natitira na lang na ating challenges in the different regions, yung ating mga BHWs, yung ating mga BHERTs, and then a few healthcare workers who are waiting for their kind of, for their favorite vaccines, no? And then sumunod yung ating senior citizen. I would like to emphasize because these are the most at risk, most vulnerable. Kahit na marami tayong nabigyan ng A4, kung hindi natin nabigyan yung ating A2, sila ang magkakasakit, sila ang ma-hospitalize, sila ang mamamatay. So kaya A2 and then later on yung ating A3, yung ating mga comorbids. Of course, we have to balance this with opening the economy, and in surge areas, we allowed simultaneous A1, A2, A3, A4. So aside from the sectoral, meron tayong tinatawag na geographic. No? So we had initially NCR, this was the center of the COVID epidemic. And then we had the +8, yung tinatawag natin noon na NCR bubble. And then our experts also recommended that we focus immunization in these +6 areas. This is the bubble around NCR. Then we included Cebu and Davao kasi naman sila ang they were also having cases, especially in Cebu, rising cases. And these are our economic hubs. And then, kaya nagkaroon tayo ng +8. Yung +10 are now the new cases, new case areas that have been identified by the IATF. Nabigyan din ng more allocation. Outside of that, we are also looking now at trying to, for the next deliveries, no? Kung mas marami na tayong bakuna, saan mga areas ang hindi pa nakakabakuna ng kanilang A1, A2, and A3. So babalik po tayo sa ating tinatawag na sectoral prioritization, especially with the importance of completing the doses with A2, with our second dose. Thank you.
Thank you, Yusek. Along that lines, from Sheila Crisostomo, may mga bagong strategies po ba tayong planong gawin para maabot ang target na bakunahan ang 90% of A2 by the end of July? Ilan ang lahat ng senior citizens na dapat pong mabakunahan?
As I mentioned, 8 million yung ating naka-master list. So hindi naman ito out of the blue kasi sila na ang nag-master list sa mga areas nila kung sino yung mga senior citizen. So dapat na-meet nila yan. Ano yung mga ating mga estratehiya ngayon? Kagaya ng sabi ni Sec Rosette, nagtutok A2 town hall tayo. May mga, we have been talking with our R-Box and our L-Box. Ano ba yung mga pwedeng mga gawin? Nakita natin yung mga challenges and barriers. Unang-una, nahirapan sa technology yung pag-register. So we have advised na mag-barangay and then try to really look and encourage and schedule the vaccination of the senior citizen. May mga senior citizen ayaw magpabakuna kung sila lang. So in time for other areas, pwede naman yung A4 or your A5. So kasabay na nilang may bakuna yan. And then yung meron tayong dedicated lanes. While we allowed A4, meron siyang priority lanes for A2, A3, and A1. In many areas nga, hindi ka na kailangan pumila pag senior citizen ka. Basta pumunta ka lang sa vaccination center. Some LGUs allow the vaccination, anong tawag dyan, walk-in. No? Some naman, nagpa-register lang, tapos binibigyan ng schedule. Tapos meron yung mga nag-house to house. They also bring mobile vaccination teams and yung mga may bus to the areas where there are senior citizens. Yung medyo hindi makalakad, bedridden, meron din naman tayong nag-house to house. Many of the LGUs have already done house to house vaccination of our senior citizens, na especially those who are bedridden. Thank you.
Thank you, Yusek. So questions lang po regarding sa challenges ng vaccine delivery na nabanggit nyo. Ano daw po ba yung mga nakikita nating challenges ng vaccine delivery sa BARM? And another question is, bakit po may bawas ang darating na Sputnik 5 doses? Logistics pa rin po ba ang reason? Yusek, nakamute po kayo, sorry.
Okay. In terms of the challenges sa BARM, magkalayo kasi yan eh. Meron tayong Maguindanao at Lanao del Sur. Lanao del Sur in one side of the country, and wala silang cold room na malaki, hindi kagaya sa original region. So they store it in refrigerator. Yung Basulta, Basilan, Sulu, Tawi-Tawi are adjacent to Zamboanga. Nung wala tayong mga influx of many vaccines, nakikigamit sila ng cold room sa ating Region 9. But now they cannot be accommodated kasi nga marami na rin bakuna na dumadating. The regular vaccines and the COVID vaccines. So we have also our partners from UNICEF and other development partners who are looking ano ba yung pwede natin gawin sa Basulta. The other challenge, pag naglagay ka sa Sulu and Tawi-Tawi, hindi po regular yung flights, no? May flights ka, tapos kung may boat ka, and then even within the area, kung may peace and order conflict during the time, so kailangan i-secure yung bakuna, and then kung may mga brownouts, so we cannot also give very large quantities of vaccines. Although we are now trying together with the BARM and our development partners, ano pa ba yung mga pwede nating magawang mga strategies, especially for the Basilan, Sulu, and Tawi-Tawi areas.
That's very clear, Yusek. Before I ask for your final message, a few questions pa po, no, from Red Mendoza. Sabi po ng ni Father Nick Austriaco ng Okta, sa 30% vax rate, we may foster resiliency against the Delta variant. Ano po ang inyong reaction dito? And ano rin po yung reaction ninyo sa mga naglalabasang balita on the questions of efficacy ng certain vaccines regarding the Delta variant?
Maybe Yusek Rosette can answer this in terms of the efficacy of the vaccines. Aaralin pa yan in terms of the world, real world effect dito sa ating bansa, but we can compare with the experiences abroad. Yusek Rosette?
Yes, no? So yung magkakaroon ng magiging resilient for Delta variant if we achieve 30%. Actually, it's not just the Delta variant. Magiging resilient sa COVID-19, no? Dun sa sakit mismo against all of these variants if people will be vaccinated. And if we can reach this 30% to 50%, yun yung lagi natin sinasabi na population protection. Kung sakaling makarating man tayo dyan, lalong-lalo na dun sa 50% na meron or 30%, ay natugunan natin yung A2 at A3 natin because they are the most vulnerable to this disease. So it's not really Delta variant, but among all of these variants na meron, the SARS-CoV-2 virus, magiging resilient talaga ang bawat populasyon. Not very specific on these specific types of variants. I just like to also make mention na itong mga real-world studies natin nakapagpakita naman, ano, and malalaki na yung studies na ginagawa sa ibang bansa. Katulad nitong ginawang study for Sinovac, 10.2 million population yung kanilang real world na ginawang for that population in that country na nakapagpakita na against this COVID-19, against symptomatic disease, meron silang 65% at least, no, na protection. Against hospitalizations, deaths, meron silang almost 90% na protection. So kapag ka po ganito ang pinapakita ng real-world evidence, tayo po ay mas nagiging kumpiyansa sa mga bakunang meron tayo dito sa bansa. So we agree with Father Nick na yung resiliency ng bansa sa mga variants kapag ka mas mataas ang bakunahan, dahil alam naman po natin the vaccines will really help us protect our population from all of these variants that are existing in the country.
Thank you, Yusek. Follow-up daw po, so I'll entertain this for Yusek Mirna. Yusek Mirna, ano bang difference ng population protection sa herd immunity?
Si Yusek Rosette pa rin yan kasi yung technical aspect yan.
So when we talk about herd immunity, we're talking about a portion of the population that needs to be immunized so that we can say that there is this immunity for the rest of the population. So pag sinabi nating herd immunity, halimbawa 10 ang tao sa isang lugar, babakunahan ko lang ang 9 at masasabi ko na kahit hindi na bakunahan yung isa, may herd immunity na at protektado na siya. That's herd immunity. But when we talk about population protection, meron ka ngayong priorities, meron kang gusto na pagtugunan dahil gusto natin i-protect yung population. And what would be the most important thing when we talk about population protection? Yes, we need the coverage for this specific portion of the population. Katulad ng sinasabi natin, 50% para sa atin, ano? Pero ang mas importante na punto dun sa 50%, na bigyan natin na mataas na coverage din, yung pinaka-vulnerable sa populasyon natin. And these are the senior citizens and those with comorbids. So that is population protection.
Okay, thank you, Yusek. That's very clear. So population protection, lower hospitalization, lower deaths, no? Yusek, I think we missed answering this po. Bakit daw may bawas ang darating na Sputnik doses today? Logistics pa rin daw po ba ang reason?
I am not sure kung anong ibig sabihin ng bawas. Kasi ang alam kong dadating na Sputnik V, yung pang 50,000 na second dose, nung binigay natin na first dose, medyo, ito yung sinasabi nilang delayed, but inapprovean na po ng FDA, Philippine FDA na pwede ng 21 days to 42 days ang interval ng ating Sputnik V. Baka yung sa component 1, doon ang binawasan. I am not very sure what is the reason kung bakit binawasan. I have not been appraised, but please be assured that the second dose of 50,000 for those who have received the first dose will be available.
Thank you, Yusek. That's the last question for you. I give you now the floor for your final message and mga reminders po sa ating mga manonood.
Maraming salamat. Again, magpabakuna. The best vaccine is the vaccine that is available. Please make sure that you get your second doses and let us work together to have vaccination of our community. Kung yung mga kailangan magbakuna na sa mga neighborhood ninyo, please sa mga opisina ninyo, kung nasa mga priority areas, let's all help in the advocacy so that we have increased protection in our work areas and in our homes. Thank you.
Thank you so much po, Yusek Mirna. And that's it for Yusek Mirna. We'll be sending the regional vaccination rate po sa inyo sa ating Viber group. Now we'll proceed to the questions for Yusek Reset, beginning with Red Mendoza's question. Yusek, a certain group that is advocating for ivermectin use in the country, went to the Commission on Human Rights to say that excessive lockdowns, coercive promotion of vaccination, discrimination against the unvaccinated and the children, and the inhibition of ivermectin are human rights issues. What does the DOH and the government say about this? Do we need to improve our communications more to prevent these kinds of communication from spreading falsehoods that do not have scientific basis? Yusek.
Unang-una, kailangan natin ilagay sa konteksto, ha. So Red, lahat ng tao, lahat ng grupo may karapatan yan para lumapit sila sa kahit na anong government institution so that they can be able to express kung ano yung sa tingin nila, opinion nila na kailangan i-address ng gobyerno. At bukas tayo dyan, ano? So kailangan lang natin sagutin punto per punto, kailangan ay mapaliwanagan din ng ating mga kababayan. Uunahin ko na yung ivermectin. This has been a very long issue na hanggang sa ngayon naman at based from the latest article na ebidensya na lumabas. I think that was about days ago. Lumabas na na sinasabi ng article ang conclusion nila doon sa pag-aaral in comparison to the standard care or placebo, yung ivermectin did not reduce the all-cause mortality, length of stay or viral clearance in RCTs in COVID-19 with mostly mild disease. Also, sinabi dyan, ivermectin did not have any effect on severe COVID-19. So, nilagay din at the final note nila, ivermectin is not a viable option to treat COVID-19 patients. Ang kagawaran po ng kalusugan kasama ng buong gobyerno, umaakto po tayo at nagre-responde dito sa pandemyang to based on science and based on evidence. Kung makikita po natin na ang isang gamot ay magiging epektibo para sa COVID-19, hindi po natin pipigilan ang paggamit nito sa ating populasyon. Pero kailangan maintindihan din po ng ating mga kababayan na ang kagawaran ng kalusugan at ang gobyerno ay mayroon responsibilidad para protektahan natin ang ating populasyon. We need to ensure that all of these drugs that are available for our citizens will be safe and it's going to be efficacious for them. Ibig sabihin, mapoprotektahan sila based on the indication of the drug. At hanggang sa ngayon po, hindi pa natin nakikita, base sa sayensya at saka ebidensya, na itong ivermectin ay makakapagbigay ng tulong para sa mga taong may COVID-19 dito sa ating bansa. Pangalawa, yun pong mga punto na sinasabi, katulad ng excessive lockdowns, coercive promotion of vaccination, we have never coerced anybody to be vaccinated. Kaya nga po voluntary. Lagi po natin sinasabi, ang pagbabakuna ay voluntaryo para sa isang individual. Kaya tayo sa mga communications handle natin, pilit nating ini-encourage ang ating mga kababayan na magpabakuna pinapakita at pinaparinig natin sa kanila kung ano ang pwedeng maging benepisyo nitong bakunang to para sila ay makumbinse. But we never coerce anybody dito sa pagbabakuna na ito. In fact, sa mga iba't ibang mga policies na pinapalabas ng ating national government agencies. For example, sa Department of Labor and Employment, meron po silang mga nilalagay na hindi pwedeng pilitin ng mga employer ang kanilang mga employee na magpabakuna. Nandyan pa rin ang karapatan ng ating mga employees kung ayaw nila magpabakuna o hindi. About coercive lockdowns, ito pong lockdowns na to, pag tinignan po natin, ito po ay nakatulong sa atin para ma-contain natin ang mga sakit at hanggang sa ngayon ay hindi pa rin talaga tayo pinapasok nito mga malalalang variants na meron tayo dito. And if you will see our trends in cases, 2 beses na po nating na-contain ang dapat pa-surge na mga kaso dito po sa ating bansa. So hopefully po, ito pong mga ganitong mga hinahain sa ating national government agencies, as I've said, bukas naman po tayo and kung yan po ang kanilang opinion, irerespeto po natin yan. Pero sana po ang ating mga kababayan ay naliliwanagan din po dito po sa ginagawa nating response para sa pandemic na ito. Laura.
Thank you, Yusek. Very clear po, no? So we've never coerced anyone to get vaccinated. We're moving towards granular lockdowns. Yan po yung sinasabi ng DOH, no? Second question, Yusek, Singapore daw. Singapore has said that it is not adding a certain vaccine, Sinovac, to its overall COVID-19 vaccination tally because it still is awaiting critical data from the company. Do we see this as a vote of no confidence on the vaccine in other countries? And would this be a hindrance on the Filipinos who are vaccinated with Sinovac that would plan to visit Singapore?
I think wag natin ilagay sa konteksto na no vote agad, no vote confidence yung sinasabi. Ang sinasabi ng Singapore, mag-aantay sila ng datos galing sa manufacturers ng Sinovac. But they did not say na ayaw nila kasi wala pa, hindi nakakapagpakita ng magandang proteksyon sa kanilang kababayan. Babalik tayo uli dun sa ating sinasabi kanina na meron na mga pag-aaral na lumalabas sa ibang bansa na naisagawa na itong Sinovac vaccine na ito ay nakapagpalabas ng real-world study nga, and it's saying na it's effective against hospitalizations, severe COVID-19, against deaths, and even symptomatic infections of COVID-19. So kailangan lang po natin talagang antayin na makapagpalabas ang mismong manufacturers ng Sinovac so that Singapore also can have their listing revised kung sakasakali. Tandaan natin ang Sinovac ay nakasama na rin po sa WHO emergency use list. That alone proves na naipakita nito na ito ay dekalidad, may kalidad siya, quality, at saka safe siya para sa population.
Salamat, Yusek. How will the DOH respond po to the comments po na mabagal magsara ng border ang bansa kaya nakapasok ang variant since last year? Ano po ang dapat improve natin, like genomic sequencing po ba para sa mas maayos na surveillance ng variants?
Caroline, hindi lang naman travel ban ang ating strategy na pinapatupad para tayo ay makapag-prevent ng entry ng variant sa ating bansa. Aside from doing these travel bans, meron din tayong mga control sa borders natin. Katulad nga nung obserbahan natin ngayon na nire-revisa namin yung mga protocols, no, as soon as evidences come out. That's why nakapag-revise tayo, naging 10+4 ang ating quarantine and testing sa ating borders kasi nakapagpakita ng bagong ebidensya ang ating mga eksperto. Aside from that, hindi lang po yung border control at saka yung travel bans, meron din po tayong safeguards sa ating mga communities na para masabi natin na kapag dumating na dun sa punto na nasa komunidad na ang mga variants na to, we can still be protected against these variants. We have this strategy and framework we call 4-door policy. Itong 4-door policy na ito, this is adopted from the WHO and other reputable international organizations for health kung saan sinasabi na aside from travel ban, meron ka pang dapat na mga i-institute dyan sa iyong bansa para ma-contain mo ang transmission ng sakit. At pag tinignan natin, nakikita naman po natin na nagiging effective ang ating mga ginagawa dito, no? So, whole genome sequencing, makakapag-improve ba? Nandiyan tayo lagi, no? We are open and talaga namang gusto nating i-expand din itong biosurveillance natin. It's very critical, especially at this point in the pandemic. Pero yung ginawa ng biosurveillance natin dito, base sa mga nagawa na natin out of all of these samples tested, we were able to detect already, no, kung ano yung variants na meron sa ating bansa, nasaan ang mga variants na ito. And what we need to just do right now is to expand so that it can be more accessible. Kasi ngayon, meron tayong mga challenges pa rin, of course, that we get samples from different regions, dadalhin sa Maynila dahil nandito ang Philippine Genome Center. So that's our next step for biosurveillance, na makapag-expand tayo ng laboratorio na maaring makagawa nito so that strategic ang sites natin for biosurveillance.
Yusek, next question will be about ano na po ba yung final IATA protocol regarding interzonal domestic travel?
Yes, no, this will be announced by spokesperson Harry Roque later on sa kanyang briefing. Mamaya, no, I think that's lunchtime. Pero ang sinasabi lang na nakapagkasunduan na sa IATF kahapon and different local government organizations were there na pag-usapan na sinasabing wala namang ang Resolution 101 at saka 124B ay pareho pa rin at wala namang contradictions at ipapatupad. Ibig sabihin, yung recognition ng fully vaccinated, gagawin pa rin yan. But for those local governments na meron silang protocol na pagtetest, kung sa tingin nila, based on risk assessment nila, ay kailangang itest ang kanilang mga travelers, binibigay pa rin yung authority sa kanila. So yun po yung napagkasunduan, and the full details of this will be announced by spokesperson Harry Roque later on.
Thank you, Yusek. Update po sa Davao Oriental patient na namatay daw at nag-positive for the South African variant.
Well, this patient died last, I think, May 17. He's a 63-year-old male. Nagkaroon siya ng COVID, and nung na-sequence yung kanyang sample, it's positive for the variant, Beta variant. That's the South African variant. Pero kailangan natin balikan kasi kamatakot yung ating mga kababayan, na itong tao ay meron siyang comorbidities. So he had hypertension and I think he had diabetes. So pag tinignan po natin yung profile ng tao, he is very vulnerable to this disease of COVID-19. So hindi po natin pwedeng i-attribute agad that this variant has caused this severity of the disease of this person kasi nandun yung factor niya na may comorbidity siya. So whether whatever variant or whatever type of the SARS-CoV-2 virus that has afflicted this person, yun pa rin po yung risk factor niya because he has comorbidities. So yun lang po ang gusto nating ipaliwanag, at sana yung interpretation ng ating mga kababayan ay maliwanagan po sila, no, na wag natin ituon na sinasabi natin na itong South African variant has caused this severe form of this disease because kailangan po ng formal na pag-aaral para dyan. We are just stating the facts right now na this is a 63-year-old male with comorbidities of hypertension and diabetes who died May 17, and sinasabi din natin yung kanyang risk factors would be that he is most vulnerable to this disease, and it can happen among whatever variants there is for this disease.
Thank you, Yusek. Kaya sa mga nasa A3, kailangan nating magpabakuna. Gagamitin pa rin po ba ang booster shots? Gagamitin rin po ba ng booster shots ang Pilipinas? Gagamit rin po ba ng booster shots ang Pilipinas? Sorry. Pfizer said that they'll be asking FDA to authorize a booster dose of their jab as Delta variant spreads. Ano pong reaction natin dito?
Well, pinag-uusapan yan at pinag-aaralan yan ng ating mga eksperto. Actually, yesterday we had a meeting with our all experts group at pinag-aralan at pinag-usapan itong booster shots para sa mga bakuna. So unang-una, ang kanilang rekomendasyon, hindi pa natin yan irerekomenda. Kailangan pa ng mas madaming ebidensya para masabi natin that it's going to be safe. Ang ating primary consideration dito is safety, at hindi pa rin po kasi nakakapagpalabas ng mga studies na kumpleto para masabi natin that we need booster doses. When we talk about booster doses, this talks about boosting your immune response, no, based on the length of immunity na ibibigay ng bakuna. Hanggang sa ngayon, wala pa hong manufacturer na nakakapagbigay talaga ng eksakto na sinabi nilang, etong bakuna ko, hanggang 6 na buwan lang at kailangan mo na uling-ulitin. Wala pa hong ganong ebidensya. Pangalawa, kailangan din natin isipin, dito sa ating bansa, ang ginagamit nating platform or ang ginagamit nating mga bakuna ay hindi ganun kapareho, no? Most of our vaccines that we are using are inactivated platforms. Ito pong Gamaleya, Sputnik V at saka Sinovac. Na wala pa rin po tayong nakukuhang sapat na ebidensya for these vaccines on how we can do the booster. So kailangan ho nating antayin lahat itong mga ebidensyang to. Pangatlo at pinaka-importante, nakikiusap po kami sa ating mga kababayan na sana po antayin natin ang ebidensya para dito sa booster doses. Let us have that kind of nationalistic spirit ba yon, na solidarity. Marami pa ho sa ating mga kababayan na hindi nababakunahan. So yung para isipin natin na mag-a-allocate na tayo ulit para sa mga booster doses ng mga taong nabakunahan na, ay wag muna po nating isipin. Ang isipin muna natin, ang ating goal ngayon, mabakunahan the rest of the population, mas nakakadami sa populasyon, bago po natin pag-isipan at irekomenda itong booster doses.
Salamat po, Yusek. May mga nagpapatest para makita ang level ng kanilang antibodies matapos ang 2 doses ng COVID-19 vaccine. Ano ang factors ng pagkakaiba ng antas ng antibody sa vaccinated na tao? At ano po ang komento ng DOH sa nagpapa-antibody test matapos mabakunahan?
Gusto ko lang hong magpaalala sa ating mga kababayan na kapagbigay na rin po ng kanilang statements ang ating mga eksperto. Hindi po natin nire-rekomenda na magpa-antibody test kayo pagkatapos po kayong bakunahan. Unang-una, kailangan maintindihan nyo na ang ating immunity, yung sa ating katawan pag tayo ay nabakunahan, hindi lang po antibodies ang ating na-generate kapag tayo ay binakunahan. Meron pa rin pong ibang klase ng immunity na tayo ay nakakapag-produce, and this is the cell-mediated immunity. At hindi nyo po yan makikita kapag kayo ay antibody test. Pangalawa, yun pong antibody test na sinasagawa sa inyo, ang pinapakita po niyan talaga primarily would be yung antibodies nyo because you had an infection. But it's not going to give you an accurate level of antibody because you were vaccinated. So, wag nyo hong sayangin yung inyong resources para dito sa pagpapatest ng antibody. Sinabi na ho ng ating mga eksperto hanggang sa ngayon, wala pa pong validated test to measure the correlates of protection para po dito sa antibodies na ito at ang pagbabakuna. So bigyan po natin ng kumpiyansa ang ating mga bakuna. Real world studies are out already. Pinapakitang meron pong proteksyon na ibinibigay ang mga bakunang meron tayo sa ngayon. At hindi na po natin kailangan magpa-test pa nitong antibody. Baka ho mislead lang kayo. Baka mag-cause lang ng panic sa inyong pamilya kapag kayo ay nag-test ng ganito, which is not really recommended.
Thank you po. Yusek, another question is, there's a survey that has been released again that out of the 134 countries who provided data, the Philippines ranked at the bottom of an international business magazine's list of the world's safest countries in 2021. Ano pong inyong reaction dito?
Unang-una, tignan natin yung konteksto, no, nitong survey na ito. Kailangan lagi tayo maingat when we interpret this kind of surveys. Although itong mga ganitong surveys, bukas naman lagi ang gobyerno para dito at yung mga punto na nakikita naming accurate naman at saka rational, we use it for us to improve kung ano man yung ginagawa natin dito. Itong survey na to considered 3 major factors para ma-rank nila ang mga bansa. Unang-una, war and peace. Second is personal security. Third is natural disaster risk, including dun sa natural disaster, yung COVID-19. So pag tinignan natin yung mga safety scores, pag pinag-aralan mo yung mga datos, yung sa safety scores, tinignan nila yung mga factors na ito at sinabi nila na meron silang mga weights na binigay sa bawat major factor na ito. Sinabi din dyan sa datos na na detalye ng survey na yan na may mga bansa na hindi nakasali dahil hindi sila nag-submit ng data. Pangalawa. Pangatlo, itong mga surveys na to, it's a point-in-time survey. No? So when we try to analyze the data na nakita natin, yung mismong oras o time na ginawa nila yung survey, yun yung datos na kinuha nila sa mga bansa. So ang bottom line lang po, ang sinasabi natin, let's take this with a grain of salt, pag-aralan maigi kung ano ang sinasabi ng datos. Tignan natin kung bakit kinukumpara tayo sa ibang bansa with different settings and with different circumstances. Ang kailangan po natin at importante sa atin ngayon, bagamat bukas tayo sa mga surveys na to, let's focus on our country. Let's focus on what we can do to help our country. Let's focus on the response that we are doing here right now. The other circumstances, uncontrollable, like natural disasters, talagang ganun. Nandito po tayo sa Pilipinas, and ang Philippines talaga is prone to natural disasters. But you cannot rank me or rank the Philippines na lowest because meron akong uncontrollable factors such as these natural disasters. So that's just what we are saying here. Ang sa atin lang, let's stop comparing and let's just focus on what we are doing here in our country. Laura.
Thank you, Yusek. That's very clear. Another question is, there's a latest report by JP Morgan daw sinabi na kabilang ang Pilipinas sa top 5 emerging countries na vulnerable sa Delta variant. Do we share the same view?
Lahat ng bansa ngayon sa buong mundo vulnerable sa variants. Wala pong single country na magiging immune sa vulnerability nitong mga variants na ito. At naipakita po yan ng Delta variant sa mga bansang may mga matataas na ekonomiya. We have Europe having surges right now. We have states in the United States where there are surges and spikes because of the Delta variant. We have our neighboring ASEAN countries kung saan 97% ng mga kaso ngayon sa Indonesia is the Delta variant. Sa Malaysia, 30%. So nakikita ho natin, lahat ng bansa are vulnerable to these variants. So ito pong mga survey na to, again, as I've said, bukas tayo, no? We use kung anumang datos ang meron dyan so that we can improve. Dahil hindi naman talaga tayo perfecto. Pero kailangan din po ma-interpret natin at maintindihan natin, lalong-lalo na sa ating mga kababayan, itong kung paano ginagawa ang survey and what would be the parameters that they use for this type of surveys. So ito pong sinasabi natin, lahat tayo vulnerable dyan sa Delta variant. That's why we are trying to intensify all of our controls para ma-contain po natin, ma-prevent po natin ang pagpasok ng variant na ito sa ating mga komunidad.
Salamat, Yusek. Last two sets of questions po. From Sheila Crisostomo, nananawagan si Dr. Saloma sa mga LGUs na sa areas na may surge in cases na magpadala ng swab samples. Ano po ang nagiging problema? Bakit may kakulangan ng samples na nakukuha sa ganitong mga LGUs? Thank you.
The very first challenge will be the transport of these specimens. No? So katulad ng sabi natin kanina, we're trying to address that. Ngayon po, nagpaplano na tayo at naghahanap na ng resources so that we can expand our laboratories at makapaglagay tayo sa strategic areas of the country. Dahil sa ngayon, ang gumagawa pa lang po ng whole genome sequencing natin ay ang Philippine Genome Center. So the biggest challenge should be the transport of specimens. So ang mga local governments, kung sakali man, makakapagpadala, nasa LGU, papadala nila sa regional office, ipapadala sa Maynila. And this is really quite a challenge, especially for those LGUs which are far-flung. Pangalawa, sa tingin namin, yun pong impormasyon. Not the information na kailangan nila magpadala, pero sa tingin namin, yun pong impormasyon na halimbawa may ko nakuha yung specimen, hindi ko na yan masustore, matatapon yan. So yung biobanking natin na sinasabi, kailangan alam po ng ating mga local governments that we can still store in areas na meron tayong biobanking. No? Meron tayong mga regions na may biobanking and we can still store. So ito po yung nakikita nating challenges. And the third, katulad nga ng sinasabi ni Dr. Saloma, gusto lang po namin paalalahanan ng mga local government units na maari po tayo makapagpadala ng ating mga positive samples sa Philippine Genome Center. Just coordinate with your regional offices, your epidemiology and surveillance unit lalong-lalo na po kung nakakakita kayo ng kakaibang trend ng mga kaso dun sa inyong lugar. Magpadala po kayo agad at isasama po natin yan dun sa ating whole genome sequencing. Although advisories have been sent already, we just need to remind every now and then our local governments para po makapagpadala sila ng specimens.
Yusek, last set of questions regarding vaccination cards. According to Mayor Binay, their vaccination card has unique security features that make it ideal for use as a vaccine passport by fully vaccinated residents and employees in traveling to places outside Metro Manila. Do you encourage other LGUs to have this kind of vaccination card that applies a technology to make the card tamper-proof and impossible to replicate? Is it also advisable na soft copy lang ng vaccination card ang binibigay sa vaccinees tapos sila ang magpiprint? Kung maglalabas po ng uniform vaccination cards or certificates, paano po ang mga cards na na-issue na? Maraming LGUs ang nag-i-issue ng cards ng coupon bonds lang na nai-reproduce sa photocopy or Xerox machines. Although Yusek na-discuss to sa IATF that the issue is about authenticating them, not the form. Yusek.
Yeah. Yung sa Makati, that's a good practice, no? So we really need to use technology so that it's going to be tamper-proof, hindi po na na-fake, ma-verify agad. Because if you use technology, you can easily verify these vaccination cards. And that's one of the issues. Kaya hindi natin masyadong mai-push for border control itong ating vaccination cards. The ICT has committed yesterday in the IATF meeting na meron na tayo na sistema. Katulad ng sabi ni Yusek Mir na kanina, kailangan lang talaga local governments has to cooperate and submit every day etong listahan nila ng mga nababakunahan. Yung sa DICT na gagawin, it's digitized. Nasa telepono lang po natin, meron lang po tayong parang application at nandun na po yung inyong vaccination card which can be verified by scanning the QR code. So ito pong mga local governments, alam natin na may kanya-kanya tayong sistema ngayon, pero gumagawa po ng paraan ng DICT that all of this will be harmonized and the DICT system will be our main verification point. Pagka po na kompleto na ang pag-upload nila nitong mga nababakunahan para sa sistema na ito. So for those using coupon bands, for using yung mga hindi po verifiable na mga materials, hinihikayat po natin ng local government units natin na gumamit po tayo ng something na vaccination card na hindi naman po natatamper at hindi naman easily na nasisira at pwedeng itago ng ating mga kababayan while we are waiting for the DICT system to be fully functional.
Thank you, Yusek. And that will be the end of our media forum. For your closing remarks, Yusek.
Yes, gusto lang ho namin magpasalamat uli sa inyong lahat because we know na kasama po namin kayong lahat ang ating mga media partners sa pagpapakalat ng tama at accurate na information. Kami po ay nagpapasalamat din kay Yusek Mir Nakabutahe dahil pinaunlakan niya po ang ating imbitasyon para makapagbigay ng updates ng COVID-19 vaccination program sa ating mga kababayan. Patuloy po ang pagkilos ng ating National Task Force at saka ng ating National Vaccine Operations Center upang mas mapabilis at mas maisaayos ang ating vaccination program. Kaugnay nito ay patuloy po nating hinihikayat ang ating mga local government units at bawat vaccination sites at teams na pag-igtingin ang pagbabakuna sa ating mga nakakatanda, ang ating mga senior citizens. Habang tayo po ay nagbubukas at nagpapalawig ng pagbabakuna sa ibang sektor, lalo na po dun sa mga regions na nakakaranas ngayon ng pagtaas ng kaso ng COVID-19, kinakailangan pa rin po natin ang patuloy na mga paraan na i-adapt at kumilos upang bigyang priority po at maipaabot natin ang ating mga bakuna sa ating mga nakakatanda, sa ating mga lolo, sa ating mga lola, sa ating tatay, sa ating nanay, sa tito, tita, na sila rin naman ay alam natin, sila po yung pinaka-vulnerable sa sakit na ito para po sila ay maproteksyonan. Isa po sa pinakamahalagang bahagi ng ating pagresponde sa COVID-19 pandemic ay ang ating laban sa misinformation and disinformation. Nananawagan po kami sa patuloy na suporta ng ating media partners at syempre sa ating publiko upang maghatid lamang tayo ng wastong impormasyon. Alam po namin na kasangga namin kayo, ang media, sa paghahatid ng tama at factual information sa public. At para naman po sa ating lahat, ating ugaliin na kumuha lamang ng impormasyon sa mga mapagkakatiwalaang sources at hindi pawang sa mga sabi-sabi lang. Let us always verify our information and responsibly pass on this information to other people. Lastly, while we are seeing a consistent downward trend in our cases, let us all not be complacent at this point. Nakakakita rin po tayo ng spikes in cases in our identified flagged areas. Hindi po tayo maaring maging pabaya sa pag-iingat para sa ating mga sarili at para po sa ating pamilya at sa ating kapwa. Hindi po kami magsasawang magpaalala sa inyong lahat na patuloy pa rin po tayong susunod sa ating minimum public health standards at safety protocols sa lahat ng oras at pagkakataon. Para naman po sa ating mga local government units, let us work together to control our local cases and prevent further infection. Bantayan po nating maigi ang mga kaso sa mga lugar at maging proactive po tayo. Let us intensify active case finding, implement granular lockdowns, and strictly implement our border controls. So yun lamang po, sama-sama po tayo sana lahat para po tayo ay maging bida solusyon. Magandang araw po sa inyong lahat. Happy weekend to all of you and we will see all of you on Monday. Salamat, Laura.
Thank you, Yusek. Thank you to our media partners. See you on Monday.